be clear, the modelling's very interesting and very useful. It just doesn't say with the certainty and precision anything like what the Prime Minister and the business community says it says. You know, the devil is always in the detail, and we shouldn't blame the modellers for that. I think we need to scrutinise why the politicians are taking a complicated story and saying, so if we just get vaccinated, we'll all see each other for Christmas. The modelling doesn't say that.
Okay, well, you've taken a close look at this modelling and you're putting out a paper today. Tell us what you've found.
Well, let's start with 80% adult vaccination. That sounds pretty good. That's most of us.
Yeah.
What that means is there'll be 9.2 million unvaccinated Australians, 5.1 million children unvaccinated, and 4.1 million adults unvaccinated. So sure, 80% vaccination sounds like a lot. Well, 9.2 million sounds like a lot too. And we're talking about letting a virus that's highly contagious move through 9.2 million people. And if you listen to the press conferences in New South Wales at the moment, it's like, oh, but the people dying had underlying health conditions. Well, you know what? A lot of people have underlying health conditions, and whether they do or not, they're going to be exposed to this virus.
Sure. The rate of transmission will be reduced, though, at that level of vaccination because folk are less likely to catch the disease after you've been vaccinated and then therefore share it.
Absolutely. So let's be crystal clear. We should get vaccinated as quick as we can, and unless your doctor says otherwise, the best thing you can do for your health and your family's health and your community's health is get vaccinated. But, and here's a big but, the Doherty modelling assumes that as we're getting all this protection from vaccine, we're also keeping all of this protection that our contact tracers have given us in the last couple of years. And to be clear, in the Doherty modelling, the protection our contact tracers give us is about as much protection as the vaccine will give us. They're both enormously important in the modelling. But because the outbreak in New South Wales has run out of control, the tracing system has collapsed. So while the Doherty modelling says vaccines plus tracing will keep us safe, what's actually now happening is that the effectiveness of tracing has fallen dramatically. And we're now sort of saying, but don't worry about that. Doherty says the vaccines will fix it. Well, that's not what the modelling says. The modelling says you absolutely need both. And we've got politicians that are letting go of one important protection, saying let's just focus on the other one, when the Doherty modelling is adamant that we need both.
Oh, okay. Another point that you bring up here is about borders. What it means for, different rates of infection in different states. Tell us about what you found in the Doherty report here.
Look, it's remarkable. And again, the modellers are clear about this. It's the politicians that are making it confusing. The word borders literally isn't mentioned in the Doherty modelling. There are no borders in the Doherty modelling. What they've modelled is how the virus would move through a big uniform group of 24 million people under different vaccination rates. And that's interesting and important. But when the modelling was done in June, no one anticipated having a state like New South Wales with 2,000 cases a day on the cards, 80% of them unlinked, opening up to a state like Queensland or Western Australia with none. So there's nothing in the Doherty modelling that says it's safe for Western Australia or Tasmania to open up to New South Wales, because the Doherty modelling literally assumes that if we had an outbreak, it would already be evenly spread across the population.
Now, Richard, I guess in amongst all of this conversation, though, is we do have some pretty clear examples of how these circumstances progress in other countries. And I guess the UK is the one that we can look at most easily and most with comparison. They have had a major drop, though, in the number of hospitalisations and deaths when they have reached similar vaccination rates, have they not?
Well, the epidemiologists and the modelling make clear that we are nowhere near the degree of protection that they have in the UK. There's two ways to get protected from the virus: have the vaccine or have already had it. Now, in the UK, 97% of people are either vaccinated or have already had it, and they are still getting hundreds and hundreds of people a day going into their intensive care. Mm-hmm. So the idea that if we look overseas, you can compare it to Australia today, and keep in mind we're already opening up. Right? We're not opening up at 70. We're not opening up at 80. We're opening up right now. So we have nothing like those vaccination rates yet. We're talking about them in October, November. We're already opening up way ahead of these Doherty targets. And yes, if we look overseas, we can look at how many people die when you do that.
We are speaking with Richard Dennis this morning, Chief Economist for the Australia Institute. Richard, as you have in your name there, you are an economist. We do, of course, we read an op-ed from Dominic Perrottet, the New South Wales Treasurer, urging us to open up because, and partly he says, of the damage to the economy. What role is consideration of the economy playing here, do you think, in an urging for early opening?
Yeah, look, it's fascinating. We're making possibly the biggest public policy decision that's been made in decades, and there's no economic modelling. The Doherty Institute has not provided any economic modelling. I've not seen any economic modelling that says that opening up early and having lots of sick people, lots of absenteeism, lots of hospitalisations and lots of deaths is better than waiting till we get more of this vaccine into people's arms and opening up carefully. So Dominic Perrottet is perfectly entitled to guess that this is good for the economy. But let's be crystal clear, the Doherty modelling doesn't provide any evidence to support that. And neither has Mr. Perrottet nor Mr. Frydenberg.
Yeah. And just to reiterate too, Richard, what you're saying here is this: the Doherty modelling is a good piece of work. It's just the way it is being used that you have issue with.
Absolutely. All modelling is based on assumptions. And that is not a criticism of modelling, it is a description of modelling. Yeah. So all modelling has assumptions. What decision makers and the public have to ask themselves is, are the assumptions that the modeller made applicable to the world that I live in? Now, the Doherty modelling doesn't have state borders in it, so it can't help us have a conversation about opening them up. The Doherty modelling assumes that even if you have 1,000 cases a day, the testing and tracing regime works, and we know that it doesn't. So I think they're key assumptions that are clearly wrong or clearly a limitation. If the Prime Minister thinks that they're good assumptions to base his decision on, well, he's the Prime Minister and I'm not. Yeah. But let's not blame the Doherty Institute for the Prime Minister or the Treasurer's determination to simplify a complicated model.
All right. Well, just finally, Richard, I guess some people are listening in and thinking, well, have you come up with a solution to all this, or are you there just analysing what others are doing?
Okay. No, I don't have the solution. I wholeheartedly support the partial solution of doing everything we can to speed up vaccination. It is a race. It is a race. It's a race against a deadly virus, and we were slow off the mark. But I guess I'm arguing against another solution, which is to call the race early and say, we're tired of racing, let's move on. The data in the Doherty Institute modelling does not support calling it early. We have to stay the course.
Good. Well, good on you. Thank you very much for that perspective, Richard. We're
bottom 20% get nothing. They're really unfair tax cuts.
People want to see much stronger action from the government when it comes to climate change.
It's no coincidence that we have a wages crisis in Australia.
Transitioning to net zero emissions, it doesn't seem like there's much room for gas.